Okay, now let's go to the last part of the discussion for your for postpartum. Okay, so common postpartum issues and ano ba to? Okay, so we have incontinence, symphysis pubis dysfunction, radiastasis recti abdominis. Okay, so unahin na natin si incontinence, no? Your incontinence, no, this is evident, no, when the client or patient sneezes, coughs, no, lifting. This may trigger the incontinence, no. This is common during the postpartum recovery, no, and this incontinence could either be stress incontinence or your urge incontinence, no. So a referral to PT, no, if incontinence persists after 8 weeks postpartum, no. So common siya pagka yung mga early weeks, no, ng after na mga anak. Okay, but pag nagpa-persist siya, no, you would want to be referred to PT na. Okay? Okay, so ito na yung Kegels exercise natin, no? In your Kegels exercise, no, apart from the pelvic lock exercise kanina, ito yung parang pinaka-heart of the Kegels exercise. We have two types of pelvic floor contractions. We have the fast contract and relax. Okay? So, in your Kegels, no, there's a gradual increase in contraction over 5 to 10 seconds. Okay? And hold for a 5-second count with slow relaxation over 5 to 10 seconds. No? So, visualize an elevator. I'm not sure with this, according to references, palagi nilang ginagamit tong elevator. But it's more of, siguro, mas magigets ni patient if you would want to, pagka you have to identify kasi muna the pelvic floor muscle itself. Are you sure na ang nagko-contract a pelvic floor muscle? Or is it the abdominal muscle? So, we wouldn't want the abdominal muscle to contract at the same time when we are doing the Kegels exercise. So, what you do is, ang papagawa nyo kay patient, no, habang nag-urinate. Okay? Habang nag-urinate si patient, ito yung medyo itatry niyang pigilan yung stream ng kanyang urine. Okay? Yung nagtatry magpigil ng stream ng urine, that's the pelvic floor. That's the pelvic floor muscle. Okay? So, that kind of contraction, yun ang gagawin niya with the Kegels exercise. Okay? Along with this, no, while doing the Kegels exercise at the early parts of training, you might want to palpate sa abdomen, because when we do Kegels exercise, sa early parts, no, medyo confused pa yan si patient at medyo mahirap pang gawin yan. Okay? So, medyo mapapakontract niya ang abdomen. So, you would want to correct that, okay, as early as the initial part of the training. Okay? So, clients with poor pelvic floor muscle, just as your patient, no, should start with shorter contractions but higher repetitions, no. So, as clients' pelvic floor muscles become stronger, no, you could include a longer duration na. Okay? Longer duration. Now, this Kegels exercise, no, madali lang siya. Pwede mo siyang gawin habang nag-work. Pwede mo siyang gawin habang nag-aalaga kay baby, because all you have to do is contract the muscle. No? So, at the early parts, no, siguro mga first month ni patient, since yun nga, medyo weak ang pelvic floor muscle. Okay? Sa first month, pwedeng siguro focus kayo on doing the fast contract and then the slow relax of pelvic floor muscle. Okay? And then, as progression, no, pwede nyo nang pagawa yung pelvic floor contraction to get while doing a certain task. Maybe it could be while in supine, one leg would try to straighten the knee and then bend. Okay, so that's one task, while doing the pelvic floor contraction. Okay, so it's up to you what kind of additional task, para lang medyo i-progress yung exercise na to. Okay? Pero very, very important here, dapat hindi nagko-contract ang abdominal muscle. Okay? Next would be your symphysis pubis dysfunction. Okay? So, kung naalala nyo kanina, di ba, nabanggit natin tong si symphysis pubis dysfunction, with the relaxin hormone. Your relaxin hormone, again, it allows the ligaments to widen up to 1 inch at joint. Okay? Ibig sabihin, kaya niyang maging flexible, especially during our previous discussion, nung sa first session sa prenatal, diba, ang sabi natin, the relaxin hormone will help widen the anterior pelvic joint, which is your symphysis pubis is part of that. Okay? So, your symphysis pubis dysfunction could result either by the birth trauma, yan yung common, or kaya naman one of the problem that results with your symphysis pubis dysfunction is that it causes pain with movement. Okay? Especially walking, getting in and out of car, and bed. Okay? So, medyo, yun yung mga trigger, okay, ng pain with this one. So, what we recommend is that with the sitting posture, use a small rolled towel in the curve of your lower back. Have your bottom as far back in the chair as possible and use a footstool. So, dapat hindi nakahanging yung paa ni patient. Okay? And you have to keep your weight even over both legs when standing. Okay? Kailangan even. Kasi, when you try to imagine the symphysis pubis, so let's include a picture here. Wait lang. So, for example, this is your symphysis pubis. Okay? So, we would want the weight to be even over both legs when standing because if the relaxin hormone is still active even up to 6 weeks, may tendency kasi, na yung nagko-cause nung pain is because uneven siya. Okay? If you bear more weight here, okay, mas mapupush to, mas mapupush ang part na to. Okay, So, mas mapupush ang side na to, pushing it more superiorly than the other side, which causes the symphysis pubis dysfunction. So, that is the reason why, gusto natin na even ang weight for both legs. Okay? And then, that is why, kapag naka-sitting posture si patient, okay, gusto natin, you have your bottom as far back in the chair. Kailangan supported siya. Okay? And dapat naka-footstool para pantay lang. Okay? To keep it, leveled. Okay? Also, avoid carrying the baby on hip. Okay? When you try to carry the baby on hip, ibig sabihin, one side is receiving more weight than the other. Okay, causing a unleveled symphysis pubis here. Okay. Yeah. Also, avoid scissoring legs, lalo na dun sa mga mahilig scissor ng legs. Okay. Avoid heavy lifting as well. Okay. At least during the first 6 to 8 weeks. Okay? Kasi sa iba, medyo nagva-vary. Up until 8 weeks, nagpo-produce pa rin ng relaxin hormone. We wouldn't really know for sure. So, make it up to 8 weeks. Up to 8 weeks. Bawal muna sila. Alright? Ayan. So, that's for your symphysis pubis dysfunction. Next would be your diastasis recti abdominis or your DRA. No? DRA is a common condition, no, that occurs to some degree in nearly all pregnant women. Syempre, sino ba naman di magkakaroon ng DRA, no? Syempre, as the baby grows, no, the more that the rectus abdominis is stretched, no? Especially if hindi nag-work out si mother. Talagang mas stretch kasi weak yung muscle eh. Sa lahat pa naman ng muscle, ito yung mahirap i-work out, no? Ito yung mahirap lagyan ng tone. Okay? Mahirap siyang bigyan ng tone ang rectus abdominis, no? Kumbaga, if you are working out, no, sa gym, mapapansin niyo yun, no? Medyo nagkakaroon na kayo ng cuts sa different parts of the body, arms, legs, pero yung sa abdomen, hirap na hirap pa rin. Okay? So, merong ganon. Alright? So, your DRA, no, is defined as an interrectus distance, okay, of greater than 2 finger breadths. No? At least 2 finger breadths, no? Pag makakapan yan, because when you try to palpate it, merong parang depressed part. Okay? So, medyo obvious siya, madali siyang mapalpate, and you would know for sure that it is DRA. No? Although, researches, no, or data we have, no, hasn't found DRA to be significantly associated with musculoskeletal pain and dysfunction. Wala pa naman. It's just that ayaw natin yung ganitong muscle, no? Or ayaw natin yung ganitong positioning of the muscle. Okay, we would really prefer this one because remember, your rectus abdominis also plays a part in your core. No? So, importante pa rin siya. Although, medyo mas malaki ang role ni transverse abdominis, no, somehow, meron pa rin namang contribution ang rectus abdominis natin. So, it might not be associated with musculoskeletal pain and dysfunction, but it might be essential for the core of the patient, in which, syempre, yun yung parang pinaka generator natin ng execution of power. Okay? So, there are more researches, no, that is needed to establish what types of exercises are really effective, no, for abdominal strengthening postpartum. Okay? But, for now, no, ito muna yung recommended. Your Sarman abdominal rehabilitation exercises. Okay, siya muna. So, with this, no, you would have to progress slowly and allow time for the abdominal muscles to regain strength and function, just like your pelvic floor muscles. So, what does the Sarman exercise contain, no? Your Sarman exercise is a series of 5 progressive exercises wherein you start with basic breath, gradually progress through each level, and cue for proper form and belly contraction, and then hold. Okay? So, basically, ganun siya. What are the Sarman key points? No? So, key points lang tayo because yung mismong exercise itself, you would have to cover that in your TheraX. Okay? So, in here, ang pinaka mga important concepts and key points would be maintain basic breath, abdominal contraction during exercise. No? Avoid holding breath. No? Pwede kayong mag-hold ng contraction, but the breath itself, no, hindi. Build up to 20 repetitions each leg before moving to the next level. Okay? So, dapat kumbaga, ito yung criteria nyo to progress the exercise. No? Kailangan, maka 20 repetitions muna siya ng perfect execution each leg before moving to the next level. Okay? If client is unable to hold the contraction for duration of extension at next level, return to prior level until sufficient abdominal strength is gained. So, kunwari, no, increase na kayo ng difficulty or intensity. Alright? So, with this, okay, pag di niya kaya yung next level, balik kayo sa before. Hanggang sa magkaroon siya ng sufficient abdominal strength. Okay? Level 5 may be too difficult for some women to successfully perform. Usually, no, mothers, hanggang level 4 lang yung kinakaya talaga nila. Okay? Mga level 5, ito na yung mga athletes, yung mga talagang weightlifters, no, mas malalakas yung stamina. So, yan. Okay lang kung hindi ma-reach ni patient yung level 4. Ang gusto lang naman natin dito is mabalik yung previous strength, okay, ng abdominals. Now, let's go to the ergonomics, no? So, we're done with the common postpartum issues. Ano na lang yung mga pwede nating i-improve, okay, for the client, okay? Postpartum women should look for ways to fit their home workstations to their body, no? By adjusting baby changing table to a height that allows comfortable use without bending forward or to the side. Okay? So, medyo dapat mataas yung table kung saan nag-change sila ng diaper ni baby. Okay? Para maiwasan yung improper body mechanics. Okay? Typically daw, no, waist height ang nag-work best. Store supplies within easy reach kasi syempre medyo mataas yung table kung saan papalitan ng diaper si baby. Okay, so dapat within easy reach lang yung mga gamit. Dapat nandun na din, no? Medyo malapit na din sa table. Para hindi na niya kailangang iwan pa, baka malaglag pa yung baby. Okay? So, set up a supportive, comfortable chair for baby feedings. Use pillows to support back, a step stool to support feet, and pillows, nursing ring to support the baby. Okay? So, these are for your ergonomics. For the proper lifting technique, advise the client on how to practice proper baby lifting techniques from the crib, okay, from the carrier, and from the floor. Okay? On floor, no, squat down and bring baby or carrier to body, then raise up using legs, no? So, kailangan muna bring the baby close to the body. Saka nyo lang siya i-aangat. Okay? Para na rin, syempre, to avoid losing balance. Okay? Pag from the crib naman, slide the baby close to the side of the crib nearest you. Tighten the tummy for support and lift. Okay? Avoid bending forward to reach the baby and then saka nyo siya i-lift kasi this is prone to imbalance. Okay? Contract the tummy and exhale as you lift. Okay? So, yung prenatal exercises nyo before would really help the mother to carry the baby ng mas madali. Now, for the summary and conclusion, no? Postpartum exercise helps new mothers regain physical and cardiovascular strength. No, kaya important siya, although hindi siya nabibigyan ng importance here in the Philippines kasi nga syempre it's a developing country. The labor and delivery itself is too burdensome na financially pa lang. So minsan ito yung isa sa mga na-overlook. Exercises during the postpartum period helps women lose excess weight faster and to a greater degree than sedentary postpartum women. Okay? Empower postpartum women with exercise guidelines and training tools so they can feel confident that their fitness routine is appropriate for their level of fitness and goals. Okay? Ayan, no? Aside from this, no, I would like to add, no, postpartum exercises would help, no, yung mothers to prevent or address even, no. It will somehow not really directly address no? But it will help in recovery if there is postpartum depression, which is kind of medyo common din to some women. Okay? So that would be the end of our obstetrics. Thank you.